Yeah, I am Dr. N Upendra Kumar, Senior Consultant Urologist, KIMS Hospital, Secunderabad. Today, I would like to tell you some of the main tips for healthy kidney, for keeping our kidney healthy. So, first and foremost is that daily everyone has to take liquids, particularly either water or any liquids like cranberry juice, lemon juice, or any other juices, at least 2 to 3 liters per day. That is, should be taken in a spaced intervals, like every hour it should be either a glass or two should be taken, and after eating 1 or 2 glasses more, and when you go out into the sun 1 or 2 glasses extra, and 1 glass of water or anything in the midnight. So these are some of the things which keep the kidneys very healthy and keep cleaning it regularly, and so that kidneys doesn't form any stones or kidney infections doesn't occur or kidney doesn't get damaged. This is one tip. Second one is that we need to reduce the salt intake. Very important, because excess salt is going to damage the kidneys. So reduced salt will reduce the blood pressure, reduce the effect on the kidneys. So salt restriction is very important, and those containing high salt like canned foods or pickles, these have to be reduced as much as possible. And third one is, any patient having diabetes has to be strictly controlled with fasting below 100 or 100 and postprandial around 100, 160 like that, and regular sugar checkups have to be done to look for any kidney damage. And apart from this, patients having hypertension, who is having high BP, they need to take promptly all the drugs regularly and reduce the salt intake as already informed. And apart from this, those who are having any body pains and other things should not take over the counter drugs like painkillers, particularly either Overon, Brufen, etc. All these NSAIDs, they are going to damage the kidneys. So be aware of these painkillers and try to completely avoid painkillers, and consult a doctor before you use any painkiller, because any painkiller can damage the kidneys and it can be irreversible. Apart from this, to maintain good health, you can eat more of either cranberries, then you can have even cabbage is supposed to be good, and then you can drink more of any fruit juices like lemon juice, etc. These are all good for kidneys, as well as they prevent the kidney stone formation. Apart from this, you have to strictly restrict the red meat, particularly red meat which contains a lot of purines and which can lead to kidney damage because of increased either the protein diet or the purines. So these two have to be restricted. So red meat should be strictly avoided. Avoid all types of spinach, which can lead to sometimes of oxaluria. And those patients who have a tendency to form stones, they have to be very careful by taking plenty of liquids. Apart from that, they have to avoid spinach, tomato, and then excess dairy products have to be avoided, and red meat as already told. And most important is those patients who are having urine infections, particularly kidney infections or urine infections, they have to be taking lot of water and try to avoid too much of excess intake of all carbohydrates, that is high sugar foods. They have to be avoided, and they need to do good exercise, because weight gain also itself can lead to kidney damage. So proper weight maintenance by means of regular exercises and regular intake of liquids would reduce the kidney damage. So these are some of the kidney protecting diets and lifestyle changes. And those who are alcoholics need to strictly stop alcohol, and smokers also need to strictly stop the smoking, because alcohol can lead to relative dehydration, which can lead to kidney damage, can form kidney stones or kidney infections. Similarly, smoking also can lead to reduction in the blood flow of the kidney, can lead to chronic kidney failure or damage. So all these precautions would definitely prevent our kidneys in getting damaged. And regular checkups, at least after 40 years, every person have to have a regular kidney checkup done, and that itself can prevent any unknown kidney diseases which are inside. Thank you.